I'm Bruce Murray. In June of 2012, I lost my son Alex to the disease of addiction. He had been in its grips for 4 years that we knew of, but probably longer than we realized, because we were completely unaware of how serious his problems were. Unbeknownst to us, he was very deep in addiction. He was addicted to alcohol, to cocaine, to benzodiazepines and opiates. His drug of choice at the time was OxyContin, and we had no idea.
So people get into substance use to begin with for many, many different reasons. But as they continue to use substances over a period of time, the substances begin to have an effect on their brain cells, okay, that ultimately produce biochemical changes in the brain that result in symptoms that can reach a level where a person develops a sense that they have a compulsive need to continue to take the substance. Okay, so it's not necessarily related to their, at that point it moves beyond somewhat of a choice scenario. Their brain has a sense that they actually need it for the brain to even function normally, actually. The opiates affect what's called the precortex or prefrontal areas of the brain, and one of their effects there is that they tend to decrease a person's judgment and reasoning, which actually ties then into a person not seeing that they really are having a problem as they're continuing to use substances. And you combine that prefrontal effects in the brain with the compulsive craving I was just talking about earlier, and it's very, very difficult for a person to not just stop on their own.
It's a daily thing with them, fighting the urge every morning, waking up. How am I going to get it? Where will I find the money to pay for it? How am I going to get it? How can I get the ride over? It's even in recovery, I think this is something they have to keep shutting off in their brain.
Alex was a good kid. He ultimately suffered from the disease of addiction, and when he was on drugs, it was like Dr. Jekyll and Mr. Hyde. We were able to detect that, in fact, Alex was changing. He had hit some kind of a bottom. He was homeless. He had been in prison for numerous things, and we had shown him that we were simply not going to allow him to go beyond the boundaries that we needed to establish to make it clear that we intended to live a decent life, no matter what he did with his, but that we still loved him and that we still wanted to help him and support him when he was doing the right things and making good decisions.
Having been in this business for over 25 years, I can tell you that I've worked with thousands of people over that time frame, and I never had one person ever tell me that I saw in treatment that their goal when they started to use was to become an alcoholic or addict. Opiates can affect certainly multiple other areas of the brain. They can cause sedation in people. One of the main areas of concern would be that they tend to affect the respiratory or breathing center of the brain, and they tend to kind of shut it down. And this is one of the leading causes of an individual overdosing and dying. They shut off their respiratory center, and obviously if you don't breathe, you aren't going to be around for very long.
After achieving more than a year of sobriety, Alex relapsed.
I talked to him on the cell phone, as it turned out, unbeknownst to me, just moments before he died. And again, he said to me, "Dad, I'm sorry." And I said I was too, and we both hung the phone up, and a few minutes later, Ginny called me and told me he was gone. But for me, he was my prodigal son who had come back before we lost him. Ginny and I have agreed that we would break our anonymity to try to spread the word, because addiction has become an epidemic in our society.